Hi, my name is Nikki. I'm going to be performing an assessment on you today. Please let me know if at any time you're uncomfortable or if you have any discomfort. And if you have any questions, let me know. I'm going to wash my hands. And I'm going to close the curtain to ensure privacy, and I'm going to make sure there's adequate light. Okay. We're going to start with your cranial nerves. So I'm going to take a look into your eye with my ophthalmoscope. I'm going to be taking a look at your retina, your cornea, and your vessels. So just look straight ahead. Go in there, take everything out. So cool. I'm going to do the same thing to your other eye. Good. Okay. Next I'm going to come to cranial nerve 2 and 3, and I'm going to take a look at your pupils and check their reactivity to light. So I'm going to come in directly, just look straight forward, and check that your pupils are equal, round, and reactive. Good. And they are. And I'm going to come with some consensual direction here. Make sure they're the same way. Good. Now cranial nerve 3, 4, and 6. I have you just follow this pen here. And doing this 6 cardinal gaze. Good. And I'm going to check your 5th cranial nerve now, which is your jaw here. And have you clench your jaw. Good. And move it side to side. Any pain or tenderness there?
Nope.
Good. And then I'm going to do the Q-tip test. I'm going to have you close your eyes. And I'm going to have you tell me when you feel me touching you.
Touch you. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. Do they feel equal on both sides?
Yes.
Okay. Now I'm going to step back for a second from the cranial nerves, and I'm going to just check sensation while I'm on it. So I've got my my little sharp piece here, feels like that, and I've got my dull piece, feels like this. And I'm going to start with your face and work your way to your arms and your legs and your feet, and I want you to tell me when you can feel it,
Okay.
and if it's sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good.
All right.
Okay. Now we're going to move on to cranial nerve number 7, where I'm going to have you smile with your teeth and then frown. And then puff your cheeks out. Good. And cranial nerve number 8, we're going to do a whisper test. So I'm going to cover your ear, and I'm going to whisper a word, and you tell me which word it is.
Okay.
Basketball.
Basketball.
Ice cream.
Ice cream.
Good. Okay. I'm going to take my tuning fork here. I'm going to hit the tuning fork. It's going to vibrate and make a humming noise. I'm going to put it right on your forehead. You just tell me when you stop hearing the hum.
Okay. Are you ready to move?
Was it equal or equal on both left and right side?
It was.
Okay. Now I'm going to do the same thing. I'm going to put it on the bone behind your ear, and you are going to tell me when you stop hearing that hum. I'm going to bring it up to the front of your ear, and you tell me when you stop hearing the hum.
Okay. I can't hear you. Can't hear you.
Good. Good. And I'm going to take a step away from this real quick, and I'm going to just test the sensation on your wrist and your great toes.
Okay.
Okay. You feel that?
Yep.
Good.
Yep.
And down to your great toes.
Yep. Yep.
Good. Now, cranial nerve 9 and 10. Any difficulty swallowing? Do you
Nope.
choke on any of your foods or liquids?
Nope.
Take a swallow from me. Good. And cranial nerve 11. I'm going to have you shrug. Perfect. And number 12. Stick your tongue out for me. And go left and right. Excellent. Okay, now we're going to move on to the general assessment, which is I will be looking at the patient's general overall appearance, hygiene, clothes, the color of their skin, their nail beds, any clubbing of the fingers, cap refill, any obvious signs of abnormalities. And then I'm going to start with scalp and head inspection. So I'm just going to feel shape, contour, any lumps and bumps. That looks good there. Good. And we covered the eyes with the cranial nerves, but I would also be looking around the eyes, the eyelids, the conjunctiva, make sure that there's no redness, swelling, tenderness, drainage, anything abnormal with the eyes. And then I will move on to your ears. And I'm going to switch out my tools here. Okay, so first I would generally be just looking at the appearance of the ear, seeing if there's any redness, tenderness, swelling, drainage that's obvious, and just kind of palpate the outer ear here, the bones behind it. And then I'm going to take a look inside your ear. I'm going to just pull your ear up and back and take a look at your tympanic membrane. Make sure that it's pearly gray, white, no redness. There's the light reflux. Really good looking. Okay, next ear, same thing. And light reflex. Excellent. Okay, so I'm going to move on to your nose, and I'm going to also be taking a look inside your nose, checking for septum, drainage, redness, tenderness, swelling. Good. Good. And I'm going to palpate your sinuses. Any tenderness?
Nope.
No tenderness. Good. Okay, take a look in your mouth. And I say good. Your uvula looks good. No white patches, no lesions. Tongue looks healthy. No missing teeth. No cracked teeth. Move down to your neck. Just gonna feel for any abnormalities here. Anything obvious? Swelling. Contour. Everything feels good. And then I will be checking your lungs. I'm going to take a listen to your lungs in several different places. Have you take a deep breath for me? Right upper lobe, left upper lobe, left lower lobe, right middle lobe, right lower lobe. Great, and I'm going to come to the back. Left upper, right upper, right middle, right lower, left lower. Any shortness of breath?
No.
Just checking the chest symmetry, just on visual inspection. No accessory muscles are being used. It doesn't appear to be in distress. And everything seems to be symmetrical. But let's check respiratory symmetry. I'm going to stick my hands on the side here, and I'm going to have you take a deep breath for me.
Yeah.
Good. And feel that both my hands moved at the same rate. And then I'm going to check your diaphragm excursion, so you can just breathe normal for me for a second, and then I'm going to have you take a deep breath in and hold it. Good. You're going to feel me pound on your back here. And about right here. And right here. Okay, take a couple normal deep breaths for me, and then when you're ready, take a deep breath and exhale and hold it out. And good, and right here, and the normal distance is 3 to 5 centimeters. You can breathe. Good, now I'm going to test a tactile fremitus, so I'm going to have you say the words 99 over and over again.
99, 99, 99, 99, 99.
Good. And you can do that also on the front of the chest. Now I'm going to take a listen to your heart in a couple of different places. On this right ridge here, take a listen to your aortic valve. And your pulmonic valve. And your Erb's point. And your tricuspid. And your mitral. And I'm going to do that all again with the bell. And your aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Again, you'd be looking at any nail clubbing or cap refill, the color of the nail beds with the cardiac exam. Okay, let's move on to the abdominal assessment. So I'm going to have you lay on the exam table. Okay, so I would just generally be inspecting the abdomen, see if there's anything abnormal, contour is normal, there's no rashes, or he's not complaining of any discomfort so far. And I'm just going to auscultate each quadrant. And I'm going to palpate and just looking for tenderness, lumps, bumps, anything obvious. Any tenderness with this?
No.
Good. Okay, I'm going to have you come back up. And you can also do a genitalia exam right now, but not for this assessment. Okay, so we did genitalia. Let's finish the neurological exam. So I'm gonna have you stand up.
Okay.
Okay. Then I'm gonna have you put your arms out and touch your nose. Good. Good. Okay, now I'm gonna just assess your gait. So I'm gonna have you just walk this way so I can just see how you walk. And back. And then I'm gonna have you walk the same distance, but just toe to heel. Great, and back. And then I'm just gonna have you put your arms out and give me a slight knee bend. Good, now have you sit on the chair again. And we're gonna do this rapid movement here. Great. Now I'm going to have you take your heel, and I want you to put your heel to your knee and drag it down your shin and back up. And other side. back up. Great. Okay, so we did gait, we did hill, we did rapid.
Just what's up.
Okay, so let's check your musculoskeletal. I'm gonna assess your major joints here for any tenderness or for any abnormalities. So I'm going to feel your neck here. Good. Any tenderness with your neck?
No, that's good.
Okay, and then I'm gonna have you do some range of motion, ear to shoulder, shoulder to ear. Good. Neck forward and back. And then looking over. Good. And I'm just gonna test strength. Push against my hand. Good. And again. Good. Now I'm gonna check your shoulders and your joints here. Good. Just relax your arm. Any tenderness with your shoulders?
Mm.
You put your arms out like this and resist my arms. Good, checking strength. Good there. And elbow. Feel the elbow. And resist my arm here. Good. Any tenderness?
Mm-hmm.
Any weakness that you feel? Good. And your hands. I'm gonna have you go like this. Good. And like this. Good. And then I want you to push against my hands. Good. Any weakness noted?
Mm-hmm.
And any tenderness in your hips?
Nope.
About your knees?
Nope.
Can you pull your knee to your chest? Good. And then I'm just going to be checking, stick your, like, over me. Resist my hand. Checking for strength. Resist. Good. Other side. Resist. Good. Now I'm going to come down to your ankles. Feel any tenderness here. No abnormalities that I can feel. How do your toes feel?
Feel good.
Push up on my hands. Good. Push down on my hands. Good. Any weakness? And then I'm going to have you stand up for me and touch your toes. And I'm going to just fill up your spine. Everything feels alignment, no crookedness. Okay, stand back up. Okay, that concludes our exam. Thank you.
Thank you.